This presentation is made on behalf of Boehringer Ingelheim Pharmaceuticals, Inc. The company has provided financial support for this program. Presentation content has been reviewed for consistency with FDA guidelines.
Hi, my name is Elizabeth Volkman, and I'm an adult rheumatologist at the University of California, Los Angeles, where I care for patients who have systemic sclerosis. I'm very fortunate today to introduce a patient with scleroderma named Brittany, and she has graciously offered to share her journey with scleroderma with all of you today. Brittany, it's so nice of you to join us today.
Thank you for having me, Dr. Volkman. I am happy to be here. My name is Brittany, and I am 29 years old. I grew up in Southern California. I am a nanny, and I was diagnosed with diffuse systemic scleroderma with interstitial lung disease.
So, Brittany, I'm just curious, what were the first symptoms that you experienced that prompted you to go to a doctor in the first place?
My first symptom was the Raynaud's. So my fingers were going the blue, the white, the red, going tingling when it was cold. So it was my hands and my feet. And so that was first, and that was about a year before anything else happened. I had no underlying conditions at that time and no other kind of like symptoms. So they just said that it was the Raynaud's, told me to keep my extremities warm, and kind of sent me on my way. And then about a year later, within 6 months, all these different symptoms arose. So I had the severe heartburn no matter what I ate. I had a constant dry cough that was just dismissed as allergies or working with children. My joints were really, really sore. I lost a significant amount of weight, but nothing. Oh, and dry eye, dry mouth. That was a really big one, and one that was hard to deal with, but none of the dots connected. Nothing seemed like they went together. And so it wasn't until all the different symptoms kept happening that it was like, okay, there's something going on.
And it's really common. Other patients have the same type of experience where they develop one symptom like the Raynaud phenomenon, the changes in the hands. And this is something that can happen in people even without scleroderma. So usually doctors don't often worry too much about it. But then, like you said, then you developed a second symptom and a third symptom. And sometimes it's not until the fourth or fifth symptom that it becomes clear what is going on. But I imagine it was really stressful for you.
It was.
Yeah. Yeah. And I think, it's really important for the doctors too to establish the timing of these different symptoms and how they appear, because we use this to determine when the disease started. And the reason it's important to know when the disease started is because certain manifestations happen at different time points. So you said that you experienced a dry cough pretty early on, right?
Correct. Yes.
Yeah. And this could be a sign of something like interstitial lung disease, which again usually happens early in the course of the disease. So I'm just curious, when you saw your primary care doctor, what did they say to you?
So I had actually gone to my just college school doctor. I was on campus, and so she ran some blood work and she listened to all my symptoms, and she said, I'm going to refer you to a rheumatologist. I really think that this might be lupus. And then so she gave me the referral letter, and as I'm leaving her office, she says to me, oh my gosh, I really hope it's not this one disease where like saran wraps your whole body. And that was it. She didn't say a name, she didn't anything, but she knew that I needed to be referred to a rheumatologist. And so she did. And I had an appointment in May of 2012 for that.
Yeah, and that's another common experience of patients with scleroderma is that early on, they're often, like you were, misdiagnosed with other autoimmune diseases like lupus or even rheumatoid arthritis. And these diseases are a little bit more common. So I think that's why it happens, because people usually aren't really on the lookout for scleroderma. So then what happened next?
So she referred me to that rheumatologist, and I went to him with the minimal blood work that had been ran just at my college school. And he listened to my lungs, he felt my skin. He asked me what seemed like 100 questions. And of course, none of them seemed like they made any sense or fit together. And he looked at my mom and I, and he said, I'm so sorry. You are so young. You have scleroderma. And we had never heard of this. We had no idea what this meant. We had a ton of questions. And he gave us a huge stack of papers and was just kind of like, here you go, read up on it. And so my mom was like, okay, so like what's the long term? What does this look like? Like where do we go from here? And he said there is no long term. I am giving Brittany 6 months, and that's really pushing it. I'm going to refer you guys to a well-known scleroderma center where they can try to make you more comfortable. And he hugged us, our first time ever meeting this rheumatologist, and he sent us on our way. And that was what we had. I was 20 years old at that time.
Yeah. No, I think that, and you probably, had you ever even heard of scleroderma before that meeting?
Never. It was not, I had never heard it mentioned. The only thing that we had anything connected was rheumatoid arthritis from an aunt in the family. And that was the only thing that was even remotely close to scleroderma. So before this, it was not even a word that I had ever heard.
Yeah, and I think, because it's a rare disease, unless someone has a family member or friend that has it, most people have never heard of it before. And this is why it's really important when you're giving a patient this diagnosis or talking to them about it for the very first time, that really they need to be given a lot of information. So I think that first visit is really important. And when I meet with my patients for the first time, whether they have a new diagnosis of scleroderma or I'm the one diagnosing them, I usually spend close to 2 hours with them to be able to give them information about their illness and also to inform them how everyone's experience with this disease is really quite different, right? So just what you read on Google might not necessarily apply to you. Yeah. Do you feel like on your journey you've met other patients where you can see how there are differences even between the people you meet with their scleroderma and with yours?
Absolutely. I have met people with the exact same diagnosis, right? Like on paper, we have the same diagnosis, and yet our symptoms are so different. Our medications are so different. The way that we handle things are so different. Our doctors are so different. Everything is different. So we can have the exact same disease and the exact same complications and feel the same, but yet everything still be so different.
Right, right. Yeah. The other reason why I think it's really important to give patients all this information is that I really believe that knowledge is power. And sometimes when you're diagnosed with a disease like scleroderma, you can feel powerless, right? In the beginning, you were probably like, what is going on? Everything is out of my control. Is that kind of how you felt?
Absolutely. It was 3 months before my 21st birthday. So, yes, it felt like my world was crashing down. I not like I was gonna be 21 and I was in college and I loved my job. I was a preschool teacher and I was just having such a fun time, and it was such a prime time in my life. To get this diagnosis was devastating, and I had no idea even what it meant or what was to come of it, and that was probably the worst part.
Kind of like the unknown about everything. Yeah. Yeah. And so I think, when we give our patients the knowledge about their disease, about how their experience can be different from other people, it gives them some of that power back. Because if they have knowledge, then they're able to make kind of informed treatment decisions, because everything that happens over the course of this illness should be kind of a shared decision between you and whoever is taking care of you, but you can only participate in that process if you have all the information. So it sounds like you did get referred to a specialty center, and tell me what that experience was like for you.
So my first appointment was in May of 2012, and by June of 2012, I was able to see the specialist. It was very quick, but it was the best thing that I could have done. I came in, at that point, I had already had blood work done. And so we had a very, very long appointment. She broke things down into terms that I could understand. She knew where my lungs were at that point, and she explained, like, I'm not giving you 6 months, but I am telling you we're going to be aggressive. She gave me many, many resources on what I could do and what I could learn and what I needed to know, what was to come, just so that I could be knowledgeable about it, because we had no idea beforehand. And we left that appointment already ordering books off of Amazon and looking at the right places, right? Not looking on Google, looking on those correct references and starting to learn all that we could. And that was really helpful, having those resources, the books, the websites, and then the support groups that came later.
Yeah, that's helpful. So you would say that in that visit with the individual from the specialty center, the things that probably helped you the most were giving you the information you needed about the disease, about the treatments, where to go to learn more information. Since there's so much online, sometimes it's hard to know
Right.
where to go to get the best information. What about, did she talk with you at all about support groups or meeting other patients with scleroderma?
She absolutely did. She told me about support groups. She told me about the conferences, just all the things. In the beginning, I was not ready for any of that. I wasn't even ready to accept that I was diagnosed. So my mom and grandma, they went to the conference that summer. They did all the research. They went to support groups, and I was just kind of like, nope, I don't have this. But those resources, she always made sure that I knew where they are, I knew what they were, and that they were available to me at any point that I would have needed them.
No, I think that's great. And I think you brought up a good point too about kind of the support network around you. And it sounds like, certain family members were very helpful. And I think as a doctor who cares for patients with scleroderma, I really try to engage the family members, friends, or caregivers that are there at the visits, because I recognize that probably half of what I say to the patients, they hear, because once you say something like, oh, you have lung disease, it's hard to hear anything after that. So having people in the visit to take notes and listen can be really helpful. Do you tend to have people come with you to your appointments?
Absolutely. So I have something that all my doctors and nurses call my entourage. It's never just me. I've never been to any appointment alone. It's always been my mom, grandma, grandpa, Grammy, usually my sister. And then when I'm getting infusions, it's people coming in and out to visit. So it's never something that I had to do alone. And for that reason, exactly, because we could have 5 people in the room and only 3 of them would catch part of what she said, or I would just stop listening or tune out, or the same for them too. So it is so important to have that person, even just one person with you listening, so that you guys can then compare the notes and talk about what was said in those appointments.
No, that's really helpful. What about, did you get the impression that your doctor who was caring for your scleroderma was talking with other specialists about your care? Because I'm assuming you didn't just see a rheumatologist, but you probably saw some other people too.
Correct. So at my scleroderma center, all the doctors in the clinic kind of talk to each other. So I did see my rheumatologist, scleroderma specialist, but then I also had a pulmonologist and a GI doctor, and all of them communicated. I then also did go up to Seattle to get a second opinion, and it wasn't because we didn't trust my doctor. It was just that we just wanted to know what was happening, or if there was other things going on, or if they had kind of a different view. And we came back with that doctor and my doctor were really on the same page. They had communicated and talked about things, and that was awesome to have that open communication between all my doctors here and getting a second opinion doctor. That was really important, to have all the different sides, all the different doctors in it, and getting all the care that I needed together.
No, I think it's really important, especially because scleroderma is a condition that affects multiple organ systems. So, your lung doctor may want to start you on one treatment, and maybe it has some side effects that affect the GI tract. So, you want to make sure the GI doctor is involved and that they're talking together. I also agree with you that it's so important for doctors to speak to each other that are caring for the same patient. What we do where I practice is we have all the specialists come together once a week. So, rheumatologists, pulmonologists, radiologists, pathologists, and we talk about every patient that comes through our center. And we work together to develop a diagnosis based on consensus and a treatment plan. And what I found is not only does this kind of provide better care for the patients, but then the patients have the perception that the doctors are talking to each other. And I think this is really helpful, and this is what you experience. What do you think has been one of the more helpful things for you on your journey in terms of helping you cope with having scleroderma?
Definitely my doctor, my lifesaver. First of all, kind of just jumping in with like, this isn't the end. We're gonna do it. Like, if you're ready to fight, I'm ready to fight with you, and we're gonna do it. And that was huge for me, because the first doctor saying kind of like, this is the end, this is it, this is your diagnosis, and you're just gonna live with it for the next 6 months. And then going to this doctor like, no, yes, it's very aggressive. Yes, what you're going through is going to be difficult, but if you want to fight and your family wants to fight, like, we're going to fight together. And so she was a really big part of just accepting and getting through things. And then support groups. When I finally accepted what I had and what was coming, and kind of like, that this wasn't a part of my future, that this is my future, that this is lifelong, that I was going to be better, do better if I could just accept what was happening. Going to those support groups was the greatest thing ever. And my doctor did open up that door to me, introducing me to people when I was leaving an appointment or coming to an appointment, talking to other patients like in a smaller setting, then going to those support groups was amazing, having that resource. And that was because of her, because she opened up those doors for me and really was just like, take it.
Yeah. No, and I think that's how a lot of patients experience this. I find that sometimes early on, patients are not as open to going to support groups because they may see other patients there that are at a more kind of severe point in the disease. Maybe they're on oxygen therapy, maybe they're not walking, and that can cause them to be really afraid. But then with time, when you start to accept the fact that everyone with this disease is very unique and there's no one course of the disease that's the same for everyone, like you said, going to those sessions can be really helpful. Because probably even though your family is really supportive and your friends and your coworkers, no one truly knows what it's like to have scleroderma unless you have it, right?
Right. Absolutely. Absolutely agreed. And that's why those are so important. And even like you mentioned, that is what I was most nervous about, was seeing what my future could be or seeing what could happen down the line. That's what I was nervous about. I was 20, 21 years old. Like, I was worried about losing my hair and that I would look different. And what, like, so going to those support groups and seeing people maybe worse off clinically doing so well and doing so much, it gave me hope, thinking if I'm doing not nearly as bad clinically as they are, I can do more than they like, or just as much as they can do. And that was really like the most positive thing.
Yeah. So if you could kind of go back in time and like, or let's say you met a patient who was 20 years old who just got scleroderma, and she came to you and said, "Brittany, what should I do?" What advice would you give to her?
I think the first thing to help them do is like accepting it. At 20, you don't want to accept it. You don't want to have to accept that your life has to change because you're self-centered. That's what you are at 20. And so I think helping to accept it, but then also accepting it, but then knowing that you're not alone. So knowing that there are so many good resources, knowing that there is so much hope and that there could be an amazing future. Absolutely, like talking about the power of positivity is something that I talk about a lot. I know it's so easy to get in that deep dark hole where you want to be, and it's fine, you go there, but then you got to pop right back out. Like, you can't stay there. And I think that that's really important. But the top thing is to find yourself a specialist that knows what they're doing, that understands this disease, that is up on the treatments and what's coming and the research and all of that. And then just to get a really good support system, because you're going to need them.
Yeah. No, and I think the specialty centers are really important because what I see as a physician is that when patients go to other doctors, rheumatologists, pulmonologists that aren't as familiar with scleroderma, sometimes they're not offered all the treatments that are available to them. You know, we have a lot of new treatments, fortunately, for scleroderma these days than we once did, maybe when those doctors did their training. So that can be
Right.
helpful. I also think that even though there's not one of these centers in every city in the country, now we have more capacity for doing telehealth. So I've done some virtual appointments with patients who live in other parts of the country. And so I don't know, did you do any virtual visits with your doctor over the pandemic?
I did. I did one. I didn't love it. It was helpful. It was great to have that option. Absolutely great for people out of state. But I'm such a people person that I love being in person. I love seeing her. I love the joking and the talking and like the camaraderie that we do at my appointments, because there's things that you can't do on over telehealth, the skin score, and just there's different things that couldn't be done over the phone. So although it was super helpful and I love having that option, I love
Yeah.
the in-person visits.
No, that makes sense. The other thing that I work a lot on with my patients is, just making changes to their lifestyle. Sometimes we can make small changes with what they eat or like the positive attitude or helping them with stress, meditation. And sometimes over the course of them having scleroderma with all these other sort of positive changes they make in their life, they start to feel like almost maybe grateful that this came into their life because
Yeah.
now it's caused them to shift in a way that's made their life maybe more meaningful or fulfilling. What do you think about that?
I agree 100%. If you would have asked me this 9 years ago, I would not have answered this the same. A diagnosis that like completely flips your world around, just like you said, in the way that you eat, in the way that you do things, in the way that you can or can't work out, in the way that you can or can't even go out and do something or be around people. Getting that kind of diagnosis is so rough and it flips your whole world upside down. But I came out on the other side a completely different person that I probably would not have been had this not happened to me. I came out so much more positive, but just like really wanting to like live life and like whatever I can do, I'm gonna do it. Like nothing's gonna stop me. This isn't gonna stop me. And I'm not sure that I would have had that attitude without this. So it absolutely gave me a completely different outlook on life. And although all the symptoms that come with it are difficult and the medications and the disease in itself is so difficult, I can say that I am thankful for the changes that it's brought, the people that it's brought, and just the life changes that it has made. I'm thankful for in a very weird way.
No, and I'm so grateful that you're willing to share this experience with others, because I just think a new patient who just gets the diagnosis, if they're able to hear you speak about your experience, it will probably give them much more hope than I could ever give them, because they're hearing it firsthand from you. So I want to thank you for sharing your journey with all of us. And what about for like your family members or of patients? Do you have any thoughts for them about ways in which they could help their loved ones who have scleroderma? Like, what's been helpful to you?
Definitely the whole family reading up on things, right? Like we all read the same books and we all looked at the same resources. Be reading all the publications and all the articles and just trying to keep up on things is really important. A lot of patience. My family has a lot of patience with me, understanding when I can't make it to something, or understanding when I'm just exhausted and I don't want to go or I don't want to stay. My family is very understanding, and that has been amazing because, as you said earlier, they can know what I have, but they don't understand what I have. So I can tell them all that I want, how I feel. But that doesn't mean that they really fully understand it, but they try. And I think that that's been the greatest thing, because had I not had the support of my family or my boyfriend really just understanding and being like, okay, you're tired, you need to rest, go nap. You don't want to go, we're not going to go. Like, you like, or even like when I'm not feeling good, I know my body best, them listening to me. So I definitely think reading up on the disease as much as you can with the real information, and just being so patient and listening to your family member, like listening when they say, I don't feel good, or this is how I'm feeling, or this is what's going on. Just really paying attention to how they're feeling, because other family members will never understand. So the most that they can do is listen and feel sympathetic to what their family member is feeling.
I want to thank you all for tuning in today to listen to Brittany share her experience with scleroderma. And I'd like to thank you, Brittany, for being here and enlightening all of us what it's like to be a patient with scleroderma, and specifically what it's like to get the diagnosis. I felt like what you provided us today is so helpful, not only for patients, but also for the doctors and nurses and other healthcare providers who are caring for patients with scleroderma. I learned a lot today. So thank you so much. And again, thank you all of you for tuning in.